Welcome. Today we're diving into the world of chemotherapy-induced nausea and vomiting, commonly known as CINV. This is a significant side effect experienced by many patients undergoing cancer treatment. Understanding CINV is crucial for both patients and healthcare providers, as it can greatly impact quality of life and treatment adherence. In this video, we'll explore what CINV is, its classifications, the underlying mechanisms, and the various strategies used to manage and prevent it. Let's start by defining CINV and why it matters so much in cancer care. The CINV stands for chemotherapy-induced nausea and vomiting. It refers to the unpleasant sensation of nausea and the act of vomiting that can occur as a result of receiving chemotherapy drugs. These symptoms can be distressing and may lead to dehydration, malnutrition, and even discontinuation of treatment if not managed properly. CINV is one of the most feared side effects among cancer patients, making its prevention and control a top priority in oncology care. Let's look at how CINV is classified to better understand its different forms. CINV isn't a one-size-fits-all phenomenon. It's classified into several types based on timing and cause. Acute CINV occurs within the first 24 hours after chemotherapy, while delayed CINV appears after 24 hours and can last for several days. There's also anticipatory CINV, which happens before treatment due to anxiety or previous experiences, and breakthrough CINV, which occurs despite preventive measures. Finally, refractory CINV refers to symptoms that persist even after multiple treatments. Understanding these classifications helps tailor prevention and management strategies for each patient. Understand why CINV occurs, we need to look at what happens in the body during chemotherapy. Chemotherapeutic agents can generate free radicals, which stimulate cells in the gastrointestinal tract called enterochromafin cells. These cells release serotonin, a key neurotransmitter. The released serotonin binds to 5-HT3 receptors on the vagal nerves, sending signals to the brain's vomiting centers. This process triggers the vomiting reflex, leading to the symptoms of CINV. Let's explore these pathways in more detail. When serotonin is released in the gut, it binds to 5-HT3 receptors on the vagal nerves. These nerves then send signals to two key areas in the brain, the nucleus of the solitary tract NTS and the chemoreceptor trigger zone CTZ. Activation of these centers initiates the vomiting reflex. This pathway is central to the development of CINV and is a major target for antiemetic drugs. Understanding this mechanism helps explain why certain medications are effective in preventing or reducing CINV. Another important player in CINV is substance P, a neuropeptide involved in pain perception and emesis. Chemotherapy drugs can trigger the release of substance P from neurons in both the central and peripheral nervous systems. Substance P then binds to neurokinin-1, NK1 receptors in the NTS, further promoting nausea and vomiting. This pathway works alongside the serotonin pathway, and both are often targeted together for more effective CINV prevention. Recent research has shown that there is significant crosstalk between the 5-HT3 and NK1 pathways. This means that the two systems interact and influence each other, making combination therapy more effective than targeting just one pathway. By using medications that block both serotonin and NK1 receptors, clinicians can achieve better control of CINV, especially in patients at high risk. This crosstalk is a key reason why combination antiemetic regimens are now standard in many chemotherapy protocols. It's important to distinguish between acute and delayed CINV. Acute CINV typically occurs within the first 24 hours after chemotherapy administration, while delayed CINV develops after 24 hours and can persist for several days. Both types can be distressing, but they may respond differently to various treatments. Preventing both acute and delayed CINV is crucial, as uncontrolled symptoms can increase the risk of anticipatory CINV in future cycles. Anticipatory CINV is a unique form that occurs before chemotherapy, often triggered by sights, smells, or thoughts associated with previous treatments. This type is primarily psychological and can be very challenging to manage. It highlights the importance of effective control of acute and delayed CINV, as repeated negative experiences can condition patients to feel nauseous even before receiving chemotherapy. Behavioral therapies and relaxation techniques are often used to address anticipatory CINV. Sometimes, patients experience nausea and vomiting despite receiving preventive medications. This is known as breakthrough CINV. If symptoms persist even after additional treatments, it's called refractory CINV. These forms require careful reassessment of the antiemetic regimen and may involve trying different drug combinations or adding non-pharmacological interventions. Managing breakthrough and refractory CINV is essential for maintaining patient comfort and adherence to cancer therapy. Not all chemotherapy drugs carry the same risk of causing nausea and vomiting. Some agents are highly emetogenic, meaning they are very likely to induce CINV, while others have moderate, low, or minimal risk. The emetogenic potential of a drug is a key factor in determining the antiemetic regimen for each patient. Let's look at some common chemotherapeutic agents and their associated emetic risks. Chemotherapy drugs, such as cisplatin and high-dose cyclophosphamide, are known for their high emetogenic potential. Patients receiving these agents are at significant risk for both acute and delayed CINV. For these drugs, aggressive antiemetic prophylaxis is essential, often involving a combination of 5-HT3 receptor antagonists, NK1 receptor antagonists, and corticosteroids. Identifying high-risk agents helps clinicians plan effective prevention strategies. The chemotherapy drugs such as carboplatin, oxaliplatin, and doxorubicin have moderate emetogenic potential. Agents like paclitaxel and etoposide are considered low risk. The antiemetic regimen for these drugs can often be less intensive but still requires careful planning. The goal is always to prevent symptoms before they start, as treating established CINV is much more challenging. Several classes of medications are used to prevent and treat CINV. These include 5-HT3 receptor antagonists, NK1 receptor antagonists, corticosteroids, dopamine antagonists, benzodiazepines, cannabinoids, and atypical antipsychotics. Each class works through different mechanisms, and combinations are often used for optimal effect. Let's explore these medication classes in more detail. 5-HT3 receptor antagonists are a cornerstone in the prevention of CINV. These drugs block the action of serotonin at the 5-HT3 receptors in the gut and brain, interrupting the vomiting reflex. Common examples include ondansetron, granisetron, dolazetron, and palonosetron. These medications are especially effective for acute CINV and are often combined with other antiemetics for enhanced protection. NK1 receptor antagonists target the substance P pathway by blocking NK1 receptors in the brain. This class includes drugs like aprepitant, fosaprepitant, and rolapitant. NK1 antagonists are particularly useful for preventing delayed CINV and are often used in combination with 5-HT3 antagonists and corticosteroids for patients receiving highly emetogenic chemotherapy. Corticosteroids such as dexamethasone are commonly used as part of antiemetic regimens for CINV. While their exact mechanism in preventing nausea and vomiting isn't fully understood, they are highly effective, especially when combined with other drug classes. Corticosteroids are used for both acute and delayed CINV and are a mainstay in most antiemetic protocols. Dopamine antagonists such as metoclopramide and prochlorperazine block dopamine receptors in the brain's vomiting center. These drugs are particularly useful for breakthrough or refractory CINV and can be used alone or in combination with other antiemetics. They are also helpful for patients who cannot tolerate other medications. Typical antipsychotics such as olanzapine have also shown effectiveness in preventing and treating CINV. Olanzapine works by blocking multiple neurotransmitter receptors involved in nausea and vomiting. It is often used in combination with other antiemetics, especially for patients with refractory symptoms or those at high risk for CINV. Benzodiazepines such as lorazepam and alprazolam are sometimes used to manage anticipatory CINV due to their anxiolytic effects. Cannabinoids like dronabinol and nabilone can also be considered, particularly for patients who do not respond to standard therapies. These agents are typically reserved for specific situations and are not first-line treatments. Because CINV involves multiple pathways, combination therapy is often the most effective approach. For highly emetogenic chemotherapy, a regimen might include a 5-HT3 antagonist, an NK1 antagonist, and a corticosteroid. In some cases, olanzapine or other agents may be added. The goal is to block as many pathways as possible to provide comprehensive protection against nausea and vomiting. Before starting chemotherapy, clinicians assess the emetogenic risk of the planned regimen. This assessment guides the selection and intensity of antiemetic therapy. Factors such as the specific drugs used, their doses, and patient-related factors like age, gender, and prior CINV history are all considered. Accurate risk assessment is essential for effective prevention. Certain patient characteristics can increase the risk of CINV. Younger patients, females, those with a history of motion sickness or morning sickness, and patients with high anxiety levels are more likely to experience CINV. Recognizing these risk factors allows for more personalized antiemetic strategies and better patient outcomes. In addition to medications, non-pharmacological interventions can play a valuable role in managing CINV. These include dietary modifications, acupuncture, acupressure, relaxation techniques, and behavioral therapies. Integrating these approaches can enhance the effectiveness of antiemetic regimens and improve patient comfort. Behavioral treatments such as cognitive behavioral therapy, guided imagery, and relaxation training can help patients cope with anticipatory and breakthrough CINV. These therapies address the psychological aspects of nausea and vomiting, reducing anxiety and improving overall well-being. They are especially useful for patients who have developed conditioned responses to chemotherapy. Integrative therapies combine conventional medical treatments with complementary approaches, such as acupuncture, massage, and mindfulness meditation. These therapies can help manage CINV by promoting relaxation, reducing stress, and improving the patient's sense of control. Many cancer centers now offer integrative medicine services as part of comprehensive cancer care. Ginger is a popular alternative remedy for nausea, including CINV. Some studies suggest that ginger supplements or ginger tea can help reduce the severity of nausea in patients undergoing chemotherapy. While not a replacement for standard antiemetics, ginger can be a helpful adjunct for some individuals. Always consult with a healthcare provider before adding supplements to your regimen. Cannabis and its derivatives such as dronabinol and nabilone have been used to manage CINV, especially in patients who do not respond to standard therapies. These agents can help stimulate appetite and reduce nausea, but they may have side effects and are not suitable for everyone. Discuss with your healthcare team to determine if cannabinoids are appropriate for your situation. Experience of CINV is influenced by more than just physical factors. Thoughts, feelings, and behaviors all play a role in how patients perceive and cope with nausea and vomiting. Addressing emotional and psychological needs is an important part of comprehensive CINV management. Support from family, friends, and mental health professionals can make a significant difference. Educating patients about CINV, its causes, and management options empowers them to take an active role in their care. Providing clear information about what to expect, how to use medications, and when to seek help can reduce anxiety and improve adherence to treatment. Support groups and counseling services are valuable resources for patients and families. Regular monitoring and follow-up are essential for effective CINV management. Healthcare providers should assess symptom severity, medication adherence, and side effects at each visit. Adjustments to the antiemetic regimen may be needed based on patient response. Open communication between patients and providers ensures timely intervention and optimal care. Managing CINV requires a multidisciplinary approach. Oncologists, nurses, pharmacists, dietitians, and mental health professionals all play important roles in supporting patients. Collaboration ensures that all aspects of CINV are addressed, from medication management to emotional support and dietary guidance. Research into new treatments for CINV is ongoing. Novel agents and drug combinations are being studied to improve efficacy and reduce side effects. Personalized medicine approaches, which tailor antiemetic regimens to individual patient characteristics, hold promise for the future. Staying informed about emerging therapies can help patients and providers make the best choices. Let's recap the key points covered in this video. CINV is a common and distressing side effect of chemotherapy, but it can be effectively managed with a combination of medications and supportive therapies. Understanding the mechanisms, risk factors, and available treatments empowers patients and providers to work together for the best outcomes. Remember, prevention is always easier than treatment, so proactive management is essential. If you're undergoing chemotherapy, there are practical steps you can take to minimize CINV. Take antiemetic medications exactly as prescribed, eat small frequent meals, stay hydrated, and avoid strong odors. Relaxation techniques and support from loved ones can also help. Don't hesitate to reach out to your healthcare team if symptoms persist or worsen. Adhering to your antiemetic regimen is crucial for preventing CINV. Skipping doses or stopping medications early can lead to breakthrough symptoms and make future episodes harder to control. Always follow your healthcare provider's instructions and keep them informed about any side effects or concerns. It's important to know when to seek medical help for CINV. If you experience persistent vomiting, inability to keep fluids down, signs of dehydration, or severe discomfort, contact your healthcare team immediately. Early intervention can prevent complications and ensure you stay on track with your cancer treatment. Families and caregivers play a vital role in supporting patients with CINV. Providing emotional support, helping with medication schedules, and assisting with daily activities can make a big difference. Caregivers should also seek support for themselves, as caring for a loved one with cancer can be challenging. There are many resources available for patients and families dealing with CINV. Cancer centers, patient advocacy groups, and online communities offer information, support, and practical tips. Ask your healthcare team for recommended reading materials and support services tailored to your needs. Future of CINV management looks promising, with ongoing research into new medications, personalized treatment approaches, and integrative therapies. Advances in understanding the biology of nausea and vomiting will continue to improve patient outcomes. Staying informed and proactive is the best way to manage CINV effectively. Empowering patients with knowledge and support is at the heart of effective CINV management. By understanding the causes, risk factors, and treatment options, patients can take an active role in their care. Open communication with the healthcare team and access to supportive resources are key to achieving the best possible outcomes. To wrap up, CINV is a complex but manageable side effect of chemotherapy. With the right combination of medications, behavioral strategies, and support, most patients can achieve good control of symptoms. Remember, early intervention and prevention are essential. Don't hesitate to reach out to your healthcare team with any questions or concerns. Thank you for joining us on this journey through the science and management of CINV. We hope this video has provided valuable insights and practical tips for patients, families, and healthcare providers. Remember, you're not alone, support is available, and effective management is possible. Stay informed, stay proactive, and take care. We'd like to acknowledge the contributions of healthcare professionals, researchers, and patient advocates who work tirelessly to improve the lives of those affected by cancer and CINV. Their dedication drives progress in patient care and inspires hope for the future. Thank you for watching. We hope this video has helped you better understand chemotherapy-induced nausea and vomiting. For more information, reach out to your healthcare provider or visit reputable cancer support organizations. Wishing you strength and good health on your journey.